This lecture is very important, and in this lecture we talk about the giant cell granuloma. There are two types of giant cell granuloma, and in general there are four types of giant cells histological features lesions, starting with the giant cell granuloma, central and peripheral. The peripheral one is that one that looks like a pyogenic granuloma, presenting itself at the gingival margins and at the bone covering the alveolar bone, called the residual gingiva. And this type of peripheral giant cell granuloma or giant cell lesion is peripheral and different from the central giant cell granuloma. It can be seen histologically and radiographically, having a radiolucent space in the teeth, and could be edunculatous or sessile. And the treatment for such lesions would be a removal using a treatment plan of surgical shaving and excision. Let's move now to another type of granuloma called the central giant cell granuloma. That is also could cause a hemorrhage if it is injured, and it also can be caused by traumatic injury, calculus, or dental plaque or extraction of the tooth. Generally, the giant cell central granuloma is divided into aggressive and the normal giant central cell granuloma. It cannot be differentiated easily, but it usually occurs at the mandibular arch crossing the midline and causing pain if it is aggressive. If it is not aggressive, it will not grow quickly and cause proliferation of the bone, and it can be solved easily with an excision or even without an excision, because if it is not a neoplastic lesion. Also, the aggressive type of such lesion could cause tooth loosening and could cause many problems to the patient. Let's move now to the next type or to the next lesion called the Jerobiasm. Then we will talk about the aneurysmal bone cysts or the aneurysmal bone granuloma. But first, let us discuss the Jerobiasm. Is a type of lesion presenting itself with a plumped face and not usually require surgical treatment, because it has a high recurrent rate and it is a regressive lesion, non-malignant. This type of benign lesions is presenting itself with a very symmetrical, most of the time radiolucent area surrounded by connective tissue. And it was discovered, or it was called as Jerobiasm because of the angelic face it was presenting at the Renaissance age. Next, let's move on to the aneurysmal bone cyst, which is a type filled with blood of one type of granuloma or lesion happening in the face. And this one might cause an asymmetrical bone lesion. The aneurysmal bone cyst is well known and can be surgically removed. The last type of granuloma we'll be discussing is called hyperparathyroidism, which also presents as the giant central cell granuloma. This type of lesions cannot easily be differentiated from the cemento-osseous granuloma or cemento-osseous lesion, especially the focal one. It is caused because of low levels of serum calcium. There is primary hyperparathyroidism and secondary hyperparathyroidism. The primary one is caused by adenoma, carcinoma, or hyperplasia of the parathyroid glands. The secondary one is caused by renal failure. This type of lesion will cause stones, groans, and bone problem. Stones in the kidneys, bone stroma, and gut digestion problem, especially an ulcer in the duodenum. To make a general review, as we have finished all types, we can say there is central, giant cell granuloma, peripheral, giant cell granuloma, aneurysmal bone cysts, then the Jerobiasm, and last but not least, the one with the hyperparathyroidism, that is, a treatment is important for this lesion if it will cause the calcium serum levels to stay at a low level. And the treatment, of course, would be with surgical excision of this lesion.